I'll just today, focus on the, the discussion on the public health side of it. So we live in our country, which has actually two populations. One is India, other one is Bharat. India is basically consisting of the urban population of about 300 million people, and Bharat consisting of the rural population of around a billion people. So while India has progressed very well in the last 2 decades, we have healthcare systems which are near to developed world, world-class hospitals, doctors, and other supporting medical care. Whereas India remained in the the Bharat remained in the 19th century. Now, when I was a child, there used to be an RMP doctor who used to come on a bicycle. So we wait at a road junction waiting for him because he doesn't know who is sick. So the family members will go and wait there and say, please come to our home, so and so is not doing well. They'll come by. Actually, the healthcare was delivered at home. Today, we deliver, as Kiran Mazumdar was saying, that we deliver all these Amazon and everybody delivers everything at home, but we don't have healthcare that's being delivered at home today. And in the Bharat side of it, you will have in every village there is a liquor shop. It's available. There's a logistics are very good, so it comes there. And then you have more or less the 4G connection in most of the place. I'm not saying every place, most of the places have a 4G connection. And we also have a system where they can deliver these online goods. The only thing that doesn't happen today is the healthcare. So we need to look at what are the issues and how we want to address those issues there. Now, in the villages, now even for a small or minor issues, the people have to go to nearby towns and the cities. So because they don't have the PHCs that used to work very well. Two decades ago, the PHCs used to be manned by the very good doctors and the supporting personnel. Today, doctors don't want to go and work with them. Everybody wants to be in the urban India. So the PHCs are in a worse situation today than they used to be 2 decades ago. And the governments have introduced the healthcare supported things like Arogyasri kind of thing, and they deal with only the tertiary care. So what used to be the real importance of the population is a family doctor or a general physician. But today there's no family doctor, no general physician. So we just decide ourselves saying that, okay, I have this pain, so it must be relating to this expert. So we go to them. I go to so the first visit itself is to the expert physician, not to the general physician kind of thing. So that's because that such a system doesn't exist. We slowly over a period of time we have neglected. And we are in my mind, in a primary healthcare, we are in a worse situation today than we used to be many years ago. So, but that's a reality of it, because the doctors say that, we spend 8-10 years studying, and then now we need to recover our investment. So we don't get paid well if we go to, Bharat. So we want to remain in India, or even if it's possible, go to America. So now then how do we solve this problem? People do not want to go on serve in the way that most of the population lives. So now these people, some of us have been thinking about this issue and primarily dealing with the public health. And you know very well that we have so many medical colleges and great pharmaceutical companies and great hospitals. You'll be surprised to know that there's no public health institution in this country. Nobody cares about the public at large. It's all about you, me, and individually, and the individual to the doctor kind of thing. So there is a care for individual, but not dealing with the issues that deal with the public health. Now, COVID coming in, it's really actually highlighted the inadequacies of the Indian public healthcare system. Basically, I don't want to say we don't have any, but we have some, but it's not working. So for a while, people said there's a lockdown, countries lockdown, everybody goes to government hospital kind of thing. Then the numbers grew. All governments raised their hands and said, go and do whatever you want to do. Today, much of the population is being addressed by the private hospitals, but at what cost? I know situations where they say it's 10 lakhs rupees. When you enter, you exit, whatever that is, 10, 14 days kind of thing, you stay there. How many people in this country can afford it? And now, that leads towards the financial stress for the families. So because they can't afford it, they have to sell land, they have to sell their house so that they pay for it kind of. So that's something which is, we all always knew that the time bomb is ticking, but now with the COVID coming in, this actually has highlighted the issue, and now it's more important that we look into it. And also sometimes I'm really surprised that you open your phone with the keywords and all of them. There's a lot of people sending the messages saying so and so child requires some heart transplant or liver transplant or something like that. I don't want to sound like a heartless person, but each one saying that it requires 25 lakhs, 30 lakhs, 50 lakhs kind of thing. I never get a message that's saying that we need to help in this village in the primary health care. Nobody asks for it, but it's because it's good to dramatize a situation, or easy to dramatize a situation of saying so and so got some people got this treatment, wow, kind of thing. But something is that we as a population also, we the people, some of us who are focusing on the healthcare in the India side of it, also have neglected the remaining part of it. So under the aegis of the Public Health Foundation of India, so the Public Health Foundation of India has been there for some time. They decided to set up the institutions in different places across India in the name of Indian Institute of Public Health, akin to an IIT or IIITs kind of thing, where and there was a need for technology graduates. Then the government said, okay, let's go and set up these IIITs, about 25 of them, and now it just happened to be that I'm so fortunate that the two of those people are in this session, Professor Raju Reddy and Mr. P.J. Narayanan. And now in the same way that the PHFI, in collaboration with the central government and the state government, wants to set up the Indian Institute of Public Health. So today I'm talking in the context of that, where what we want to do and how do we deal with it. And one of that is that to deal with the primary healthcare. So some of the research fellows at PHFI and specifically Professor Suresh Muniswamy, and they have been working on this thing. They said that now you click of a button, you can order a pizza. It gets delivered at your home. So why can't we use something that is similar to that? So next slide, please. Anyway, next slide, please. Somebody is listening. So yeah, this is the one. So he got this idea from it and said that let me design something. This is something where a registered medical practitioner will start from a PHC every day, and based on the people recording in their app, saying that then the person gets his route gets the established, just like based on some algorithm, then goes and visits the person, the ailing person at their home. It's similar to what I said that long ago it used to happen in our villages. Same thing now with the modern equipment, of course, with all the facilities kind of thing. So they are designed the whole system, and that the one behind can carry vaccines, medicines, and it's like a small all the kit which has all those things there. So now this also has not only the app for route optimization, but more importantly to help the medical practitioner with all the expertise of the experts. So today AI, that's where it comes into it. So can I actually come to a stage where you can do the expertise of a famous doctor, how he or she analyzes a problem based on certain questions kind of thing. Then the RMP all of a sudden, has a tool which is probably, it can lead the diagnosis the way the expert does somewhere else. Based on that thing, the same expert system can assist. Next slide, please. Yeah. So this one actually shows you all the things that go into that box that I mentioned about, including the low temperature things, the medicines that you're supposed to store there, like some vaccines and all of them have to be stored at a lower temperature, not at a room temperature. So everything that is there on the picture is carried on, in that box there. So, and also, it's not there. System to the yes, and I can't say any better than this when you try to implement AI for this one, because this is the place we actually need So now instead of begging the doctors saying that, please come serve rural areas kind of thing, so we create a whole cadre of public health professionals. Yes, we have the nursing is available for the hospitals and all of them, but this thing is missing between the nursing and the doctors in between, which is basically the public health professionals who have been trained well, equivalent of our a BSc, whatever it is, in sciences kind of thing, equivalent. And a graduate, but the person knows how to use all these tools, how to go through the AI systems, how to get the, you teach them in the modern tools that we are looking at it, so that they're using those things, they treat the professional. At the same time, now what happens, because as the medical records and all those things are coming in now, again, one of our other former colleagues along with us at IIIT, Mr. J. Sachinaran, and now he is the chairman of the committee for establishing the standards for the medical records. So every time we talk about medical records and digital, all of a sudden the bogey comes in saying that, privacy kind of thing. I think that's can be handled with, now we are doing for the Aadhaar. Same way, the certain demographic information can be shared through the authorized agencies. But the remaining is all private. It's no, you're not sharing the complete every record of an individual kind of thing. And the systems can be built. I think with all the expertise that we have in this country, I'll be very surprised when somebody says that, how will you do it? It's doable. So that's not the basic question that, how it needs to be. It can be done. So now when these people, these medical practitioners visit places, various places there, and they keep recording information, then you have the data way ahead of when it becomes a big epidemic kind of thing. So then you actually using this data, you can do you can predict. If you predict what is happening based on the data that's coming out of the field, then you can also prevent. So it's already there in few villages, certain diseases are prevalent, they're catching up due to weather or whatever the conditions, water, weather, whatnot. Then you kind of take care of the other people coming in and go and provide with them vaccines so that it doesn't go beyond a small population. So it's basically, it's the predictive thing, and then you want to preventive mode. So now the system is there. I'm not suggesting everything is now up and running kind of thing. We intend to start with few places as a pilot study, and then based on that, the success of that pilot study, so we would like to recommend to the state governments to go and take this thing and do it. We're not, as you know, this is a non-profit organization. We're not looking at to go and make money out of it. It's primarily helping the governments to provide a better primary health care at the people place. And then the best thing is that, it's tremendously improves the productivity of the nation, because you're treating the person on the day the person is sick, rather than waiting and losing a lot of days of work. So it also helps in improving the productivity of oneself and also the nation in the context of that. Next one, please. Yeah, this I talked about it basically. So today we are not building all the artificial intelligence that is required to analyze a problem. This is different people will do it. It's something, it goes back to almost 30 years ago 35 years ago when the AI became very popular at one stage, and Professor Raj Reddy being the expert from that field, he knows it. And we wanted to build expert systems by interviewing the doctors and how they analyze a problem and all of them, but it never took off. And again, after 15 years, again in 2000 or so, Healthy and WebMD kind of organization came in. They tried to do, they did to some extent, but didn't happen. But in recent times, it's become very acceptable, and it's happening now. So various people develop ways. The problem here is you go to YouTube today, you'll have so many opinions. That's a problem. So now, which one do you want to take it? So there has to be a curated method of somebody, let's say if from a particular state or a country at a national level. So once the app is developed, even the content that goes into it are the artificial intelligence systems that are used to analyze a problem can also be curated and done, release it through that app, so that there's no confusion saying that there's so many ways of doing it. There are always many ways, and we can't avoid that. But at least there is a way that's approved by a particular state government or a government of India kind of agency there. That way the people who go to the site do not get confused with so many versions of the things that will emerge. Now, so many people will come, just like education. many people will come with many solutions now. I think since a person on the ground cannot judge what is right and wrong, it has to be a central expert committee that has to recommend the content for this app. Next one, please. As I already mentioned about the side benefit of this model that we were talking about, registered medical practitioner and the AI-based system, is that you'll be able to collect all the data in digital format, which helps the people who are analyzing the data to kind of predict what is going to happen, and then also provide a preventive thing. And already mentioned about you're enabling a medical practitioner into being, by giving these AI systems to be, in my view, better than the existing just the MBBS doctors. Next one, please. I already talked about this preventive, predictive, and the parts of personalized I didn't mention. So now with the IT systems and AI, ML, and these things coming up, once you have the profile of the individual, the physiological profile of the individual, and you link with all the technology that you have and the solutions, you can actually specifically give the medication to that individual there. So that's a level of thing. And today, the personalized medication probably is only available for people who can afford well and at very advanced medical centers and all that. I think soon the same thing can be given to the people there in the rural areas. I think this is what truly makes the whole thing as a democratization of the healthcare, in my view. It's yes, certain surgeries, tertiary cares, probably that requires really good hospitals and all of them. Just a primary care level, that's just doable at that population level itself. And I do believe that in next 10 years or so, a lot of these things, this AI and the connectivity that is there in most of the villages now, I think will improve the primary care tremendously. Next one, please. Yeah, so I'll take some questions if you have.
Yes, sure, there's a question from...
Go ahead, Rohan.
Okay. So there's a question from the audience. It goes as, what are the ways in which optimizing technology in primary healthcare will affect our productivity and our economy?
Yes. See, right now, as I mentioned, in my talk, that there's no really primary healthcare that's taken care of by the public institutions, by the government. People just go to the nearby clinic and all that kind of thing. So when you are not dealing with in a very systematic way, many people just stay home and just suffer. So during that period, they're not working. So hence, a lot of work days are lost. So and sometimes that few people get it, you can actually prevent for others, because that a lot of these communicable diseases go from one place to the other. So by addressing them proactively, we could actually prevent it from others getting it. Then hence the number of the non-working days or non-productive days comes down. Hence the productivity of the country goes up.